G'day, it's Clint Patterson here with my little son Aiden, just chilling on the bed. We're doing a little drawing, and I wanted to share with you something a little bit more adult, which was around C-reactive protein. So in this video, I want to talk about your target of C-reactive protein and why you should always have a target for your C-reactive protein and why it matters. So C-reactive protein is one of the measures of inflammation. The other that's commonly used for rheumatoid is SED rate, or ESR, as it shows up on your blood test. And my rheumatologist and I always used to pay extremely close attention and put a lot of priority on the C-reactive protein, which in his practice he believed was the very best indicator of disease activity. So if your C-reactive protein tends to follow your inflammation that you can feel and see physically, then it's a wonderful tool to use to measure your progress or lack of progress, if unfortunately the case may be. So you should set some targets. So if you're on a drug and you are hoping to perhaps not increase that drug, or even on the flip side, you're hoping to decrease that drug, then set a target for what you want your C-reactive protein to be in a period of time. So I would always get 2 blood tests done between each visit with my rheumatologist. Then when I would see the rheumatologist, I would have a trend going since the last time I saw him. So if I saw him and my C-reactive protein last time was, say, a 7, I then had 2 referrals for blood tests, and in 2 months I might be then showing a 6 and then a 4. So it's clear that I'm going in the right direction and that the medication that I'm taking is adequate. So what's your C-reactive protein target? Because when you write down the target and have it physically visible on a piece of paper, then it really helps your subconscious mind to attract that for you in the future. And it helps you take actions each day knowing that you have a goal that you're trying to achieve. So if you're trying to reduce your C-reactive protein by just a few markers, let's say from it's 15 milligram per litre down to 13 milligram per litre, it's going to be hard to motivate yourself to get to the gym and get up early to do a little green juice or something like that. But if your target is to halve your C-reactive protein and it's written down on a specific date that you need it to be done by, then you're heavily fueled with that motivation at a much deeper level because you know that you have this target that you're trying to achieve. You tend to visualize that outcome and you tend to achieve that outcome much more straightforwardly, or at least more successfully than what you would if you really don't have a specific goal. So pick a number, write it down and work towards it, and then that number is much more likely to be reached than if you are just sort of waiting to see what it might be. If your C-reactive protein does not change and it always remains below a nice low figure, then set some physical symptom goals for yourself. Maybe that your range of motion with your elbows or your knee flexion is a certain amount, then improve on what it was. Okay, the rest of the kids are coming home. I better get off this video. Hope you enjoyed it. If you want more information, more free videos, or want the most comprehensive program for minimizing rheumatoid arthritis symptoms, go to pattersonprogram.com. And it's time to say goodbye, Aiden. Say bye-bye.
Bye-bye.